So as Sue said, this ACT strategy, Access to Kidney Transplantation, Living Donation, is a provincial renal strategy because the folks at the Ontario Renal Network and the Trillium Gifted Life Network also want to increase kidney transplantation and living donation. And so as the governing body of renal programming and funding in Ontario, this is their initiative. It's being rolled, Emmett Garg is also the link here because he has a unique role and sit for both organizations and sits as the, Arena, do you know what his?
He's our provincial medical lead.
For living donation.
Yeah.
And transplantation, yeah.
Transplantation?
And transplantation.
For our transplant portfolio.
Yeah. And so they said, you know, the transplant rates in Ontario and Canada have stagnated over the last several years. And we know that those who receive a kidney donation and a living kidney donation have higher success rates, have better quality of life than life on dialysis, and sometimes even more than a deceased donor, although everyone's different. And so also, if you can get people off dialysis, you're going to save the healthcare system a ton of money. So it's sort of in everyone's best interest to try and increase the profile and use of living kidney donation transplantation. So the way that they are going to try and do this is through this strategy. And this is sort of the overall strategy. So you can see that the transplant ambassadors are a part of that. And again, that's because we heard that patients really wanted to hear from those who had been in their shoes, and that was really important to them. The other really important pieces that have been identified in helping us reach our goal of increasing living kidney donation transplantation is education, not only for potential family members and donors, but also for renal staff. So when we were doing an initial education assessment, some of the dialysis nurses, for example, said, I wouldn't know what to say about living donation. So there's some work that needs to be done which is fair, right? They're experts in dialysis, and we need that focus. But there's an opportunity there to do some education of healthcare professionals in the renal program about living donation and transplantation. So later this morning, we'll have a presentation from Dmitry Belenko, who is going to talk to you about what other educational resources are being developed, because as ambassadors, it seems like a natural extension of what you will be doing, or what you can offer those that you're talking to is providing some resources. So that's a piece. Actionable insights. So giving your renal programs specific data to help them increase their numbers. So this whole initiative is being rolled out in a quality improvement framework. So for London Health Sciences, for example, every month they're going to get a report, and some of you might have started to see this if you're going to some of your QI meetings. How many, what's what I'm looking for? Like
Expressions of interest?
Expressions of interest. Have we had initiations? How many workups have started? How many people have actually had a transplant? So they're going to be getting monthly data on how they're doing, and it's going to be compared against the other programs. And Emma always says, you know, because us physicians have a bit of a competitive streak. But what it does is it really allows them to see where they're not excelling month after month. So then the work of the quality improvement team will be like, okay, let's do something about that. And then we can see in a few months from now if this, whatever it is we decide to do is helping. So by providing the program's monthly data is another way that we think will help move the needle a bit. So again, this is more just, again, talking about we're doing this within a quality improvement framework. So some of you were there in March and learned a little bit about quality improvement, and there will be ongoing support for your quality improvement teams on what does a plan, do, study, act cycle mean, but don't worry about that right now.
You might also mention that part of our job is to give feedback from the people we speak with in the units to the quality improvement team. So when they say, you know, they're either happy with something that's going really well, or they're concerned about something. the quality improvement team wouldn't necessarily know about that, and the people in the clinics, in the units wouldn't necessarily know about it, because, you know, very often people say, well, how you doing? Well, I'm doing fine. Compared to who? I'm doing better than I was yesterday. Well, that isn't necessarily what the QI teams need to know. Why aren't you doing as well as you think you might be? Is there something that you could be provided you better, something that you think would be more helpful, something you're concerned about that is not being addressed, and that's feedback that they get.
So you are in a really unique position because you yourself and your ambassador team, peers will open up to peers in a way that they won't in another situation. So you're really going to be getting some like juicy information that then you can relay back to your quality improvement team to really help improve how your hospital's doing and increasing their living kidney donations. So it's pretty cool. So that's just sort of how TAP fits into this provincial strategy. And there you guys are. And here's a picture of everybody.
Maybe you should just say something briefly about that. There's 26.
So in Ontario, there are 26 renal programs. Because again, this is part of that research initiative, we've randomly selected 13, and you represent those 13 who are going to get this quality improvement initiative starting in October for 2 years. And then in 2019, the remaining 13 Ontario renal programs will start their own transplant ambassador programs and start getting regular monthly data and learn about additional education. So you were the first group. So Cindy was saying she was talking to folks from Kingston. They don't have any of this happening yet, but they will in 2 years from now. It's just easier to roll out.
And it also gives us a research comparator to say what's happening in the hospitals where this is
So
being
so in these, at the end of 2 years, in these 13 hospitals, where has the needle moved compared to these other 3 who weren't doing this initiative? Was there a difference?
And have you built in some buffer if this takes 6 months longer to initiate than you imagined? And in October, we're not launching because of some unforeseen
Yeah,
issues?
there's always buffer. So, yeah, there's always
There were actual researchers thinking about that stuff. Yeah.
research is slow, as you know.
So this is the quality improvement team. So you can see that there's a spot for the lead and the co-lead, and or another patient family representative who may or may not be involved in TAP. So there is all of the your program teams know that you should be a member of your quality improvement team, both the lead and co-lead. The co-lead, depending on what your relationship is like and scheduling, you don't have to be at every meeting together, but one of you should be at every meeting. So if you can work that out with your co-lead, then that would be great. And in your binders, there's also some descriptions of what these people are supposed to do, and just FYI if you're interested. So what can this group of people at the hospital, your quality improvement team, do to help support you and support TAP? Well, it's really important, and this is information that you will be able to deliver or give to your QI team. How many of you have identified like a contact person, like your top contact person at your site, like who you talk to for TAP? Yeah.
It's in the renal program.
Okay. So that's going to be your core person that you can say, hey, are you guys promoting TAP, the renal program, in the clinics and dialysis? Because what we want to do is we want to make sure that when your ambassador team goes in for their shift, that the staff know about the program and that they know what TAP is and why there's an ambassador there in a green vest and that kind of thing. So it's really important that your quality improvement team, your staff members and support are promoting the program.
So if you haven't heard from them, Emma's handed out a paper that tells you who your lead is and the contact information, so you can reach out to them and say, hey, I'm ready to get to that meeting.
They should be training you on the local kidney transplantation workup process. So Peter and Barb, you didn't do your thing at Sunnybrook, so you'll have to learn a little bit about what the workup is and what the living donation process is at Sunnybrook.
Transplants at Sunnybrook.
but it's just that there's no, it's not a transplant center, Sunnybrook, so they have to send them out to get them done somewhere else.
So, and things might have changed from when you had your transplant or workup done at the hospital. So important that you get the current process, and that's probably something that they're also working on in this quality improvement.
They'll probably give
initiative.
you a diagram of what the process is. It'll be very complex. You'll have to talk to them about it, so you understand it.
So we also want them to be able, no, they will support you with your local volunteer onboarding process for ambassadors, and we'll talk specifically about that in a little bit. They will have identified, if they haven't already, who the staff contact person for you is going to be. It's really important that when you're volunteering, you or any of your ambassadors, that there is no cost out of pocket for you. So please talk to your contact about how to support parking and or transportation. For example, at LHSC, once you go through the local volunteer services, all that stuff is covered through the volunteer program, but that may not be the case at every hospital. So just check in with your folks to see how your own parking is being reimbursed when you're going for meetings, but then how you will support your ambassadors when they're there.
And
We
if you-
have
Yeah, sorry.
we have a small budget line to support that, because we know, I think in some of the downtown Toronto hospitals, they don't have any additional parking. So talk to us one-on-one, figure out what your situation is at your hospital, talk to us, and we'll see how we can support it. Because that's important for us, that no one's paying out of pocket to volunteer for this program, including yourselves.
And people hate paying for parking.
Can-
That's-
As a personal aside, no one is unwillingly paying out of pocket. If you're willing to do it, enjoy yourself.
For sure.
Right.
Yes. We're all at the hospital enough.
So like some hospitals also have like
Yeah.
buy 30 passes for the year, and then maybe it's at your program we can help support buy a couple of those passes, and well, so it'll be different at every center, and we'll work with you to figure out how we can do that. Okay. So ensure hospital and local crisis information is provided. So again, just knowing that if you come to a challenging situation, or that you know where your local supports are. Any questions on that?
So we will need you to kind of, when you go to your QI meeting, you can take this and actually bring it up. We need to know, these are some of the things that I need you to help me with so that we can get TAP going in your area.
And we have a checklist at the end of the day with sort of all of this stuff that you can probably take with you to your next meeting.
And that's why the calls that we have together are so important, because then we can share, well, that doesn't happen at this hospital, this happens, and you can also take that back and say, we might be the only hospital that doesn't provide this, maybe we should think about it, which is food for thought, anyway. So that's why our calls together will be important, because every hospital does it differently.
But they won't only help with the onboarding of volunteers, they'll also help you in some cases to identify them.
Yes.
Yeah, oh yeah.
So if you're having problems finding other people who go on the QI, on the TAP as ambassadors, speak with the QI team. They know the people. There will be transplant nurses involved. They'll help you to promote the program by putting up posters in many of the units. You can't get into all of them yourself. You're busy. There are transplant units. There are dialysis units. There are PD clinics. There are all sorts of clinics. And just they'll put up posters. You've got the posters and emails. You'll print hard copies? Right?
Yes.
The hard copies will be printed out of London if you need them. The QI team will do more just by talking with them than we necessarily know now.
That's right, exactly. We'll talk a bit more about that as well, so it should be in a little bit.
So I'm going to hand it over to Sue just to go back to the TAP.
We'll talk a bit more about the QI team, don't worry, this is not the only, this is just a short. This is the last section before we're here.
I'm going to go to Lou, excuse me.